BCMA targeting has been the biggest advance, particularly in the last 3-4 years in multiple myeloma since having the CD38 monoclonal antibodies. We can now successfully target BCMA on the myeloma cell using an antibody drug conjugate, bispecific antibodies, of which there are many. There's certainly one license called Teclistamab, and we have 2 CAR T products in ide-cel and cilta-cel. We still have to learn as to which of these agents can be given to whom, or whether it's a matter of having access to these agents. I think we will learn with time. Certainly, CAR T-cell use data in the real world that's coming through from the United States does suggest that patients outside the stricter inclusion-exclusion criteria are also benefiting in routine clinical care. And that is really heartening to see that the access can potentially be expanded rather than to keep it to a narrow group of patients. But let's be realistic, not everybody is going to be able to reach a CAR T-cell center and wait for the time for the CAR T-cells to be produced and be given. And therefore, these off-the-shelf agents, the bispecific antibodies, are going to be extremely useful in inducing responses for patients. Having said how excited I am about the BCMA-targeted agents, we do have to take care, particularly in this patient population, because of their poor quality of life when they start all this treatment. Any level of side effects can be quite challenging for patients to be able to kind of get through. And we are starting to learn about all the different side effects with lots of different therapies and how to manage them. And this may become an increased area of focus for us over the next few years. It's about looking at patient populations who may get particular side effects or more side effects, what mitigation strategies that we can bring in, and how can we minimize toxicity whereas maximize efficacy. It's going to be a real learning process, and we look forward to kind of working more collaboratively in generating data across the International Myeloma Society.